I've got 5 pages, double-sided, of reading here. I believe these are the pages that Chief Dean referred to in his COVID update today. I've got the do's and don'ts of self-isolation, how to isolate, self-isolation after a COVID test, and guide for caregivers and household members of those with COVID-19. I'm going to read those for you. I also want to mention to you that if you go into the search bar on your Facebook and type in Lil'wat Health and Healing, it'll take you to the Lil'wat Health and Healing page. You can join that. And Jessica and Iris have been keeping us updated regarding COVID. I'll start with the page that says how to isolate. It's two-sided, and it's from the BC Center for Disease Control. How to isolate. For those who have COVID-19 or respiratory symptoms, follow the advice that you have received from your health provider. If you have questions or start to feel worse, contact your healthcare provider, 811, your local public health unit, or complete the COVID-19 symptom self-assessment tool by visiting covid19.thrive.health. Stay home for at least 10 days after onset of symptoms. Do not go to work, school, or public areas, including places of worship, stores, shopping malls, or restaurants. Do not use public transportation, taxis, or ride shares. If leaving your home for medical care, call ahead and tell the medical facility that you are coming in so they can prepare for you. Do not have visitors in your home. It is okay for friends, family, or delivery drivers to drop off food or other necessities, but try to have them drop off deliveries outside your home. Keep away from seniors and people with chronic medical conditions, for example, diabetes, lung problems, heart disease, or weakened immune systems. Avoid contact with others at home. Stay and sleep in a separate room away from other people in your home as much as possible, and use a separate bathroom if you have one. Make sure that shared rooms have good airflow, example, open windows. Keep distance. If you are in a room with other people, keep a distance of at least 2 meters and wear a mask that covers your nose and mouth. If you cannot wear a mask, people should wear a mask when they are in the same room as you. Cover your coughs and sneezes. Cover your mouth and nose with a tissue when you cough or sneeze. Cover or sneeze into your upper sleeve or elbow, not your hand. Throw used tissue in a lined wastebasket and wash your hands. Lining the wastebasket with a plastic bag makes waste disposal easier and safer. Wash your hands after emptying the wastebasket. Wash your hands. Wash your hands often with soap and water. Dry your hands with a paper towel or with your own cloth towel that no one else shares. Use an alcohol-based hand sanitizer if soap and water are not available. Wear a mask over your nose and mouth. Wear a mask, surgical or procedure mask, if you must leave your house to see a healthcare provider. Wear a mask when you are with other people. Recovery and ending isolation. You are required to stay home and isolate for a minimum of 10 days from the onset of any symptoms. You may return to your regular activities if at least 10 days have passed since the start of your symptoms and your fever is gone without the use of fever-reducing medications such as Tylenol, ibuprofen, and you are feeling better. Example, improvement in cough, runny nose, sore throat, nausea, vomiting, diarrhea, fatigue. Coughing may persist for several weeks, so coughing alone does not require you to continue to isolate. If you are experiencing your usual symptoms of seasonal allergies, you do not need to self-isolate. Some people with COVID have mild illness, but their symptoms may suddenly worsen in a few days. If your symptoms worsen, you may become short of breath. Call your family physician or nurse practitioner for immediate medical attention. If you are unable to reach your regular care provider, seek care in a COVID-19 assessment and treatment center, urgent and primary care center, or emergency department. The next page has a lot of check marks and X's and questions. It doesn't have pictures I can add into my video here, so I'm going to read and you're going to watch me knit. Do's and don'ts of self-isolation for people who may have been exposed but do not have symptoms. If you have come into contact with an infected person, you are required to self-isolate. This does not necessarily mean that you have COVID-19, but you are at risk for developing the disease and passing the infection on to others. As of March 25th, 2020, it is mandatory under the Quarantine Act that anyone arriving in British Columbia from outside of Canada to self-isolate and monitor for symptoms for 14 days upon their arrival and complete/register a self-isolation plan. There are some individuals who are exempt from this order to provide essential services, but they still require a self-isolation plan and need to self-monitor for symptoms. Do stay home for 14 days, work from home, use food delivery services or online shopping. Do keep in contact with friends, use technologies such as video calls to keep in touch with friends and family. Host virtual meetings, hangouts, family dinners, or play dates for your kids. Do get creative to prevent boredom in kids. Get creative by drawing, painting, running backyard obstacle courses and games. Do monitor your symptoms. If you develop symptoms, you should get tested for COVID at a collection center. If you are unsure or have questions, you can use the COVID-19 self-assessment tool by visiting bc.thrive.health or call 811 for advice. If you are having trouble breathing, call 911. If traveling by ambulance, notify the dispatcher that you may have COVID-19. Do protect others. Wash your hands frequently. Hand hygiene. Cover or cough into your sleeve. Respiratory etiquette. Keep 2 meters away from others. Physical distancing. Greet with a wave instead of a handshake, a kiss or a hug. Do continue to exercise. Exercise at home. Go outside for some fresh air, a run, bike ride, rollerblade, snowshoe, walk the dog or get the mail. Ensure you stay 2 meters away from others. Do clean all high-touch surfaces. High-touch surfaces, toilets, bedside tables, and door handles should be cleaned daily using a store-bought disinfectant. If not available, use diluted bleach solution, 1 part bleach to 50 parts water. Example, mix 10 milliliters of bleach with 500 milliliters of water and allow the surface to remain wet for 1 minute. If they can withstand the use of liquids for disinfection, high-touch electronics such as phones, computers, and other devices should be disinfected with 70% alcohol. Do not go to school, work, or other public areas. Example, malls, fitness centers, places of worship. Do not have visitors except for individuals providing care or delivering food or supplies. And in that case, maintain a distance of 2 meters. Do not use public transportation. Do not share personal items with others, including toothbrushes, towels, linens, thermometers, cigarettes, unwashed utensils, and electronic devices, such as phones and computers. If you develop symptoms of COVID-19, continue to isolate for a minimum of 10 days after the onset of symptoms. People who have been exposed to a case of COVID-19 and those who are returning travelers must continue to isolate for 10 days from when your symptoms started, or 14 days from when you started self-isolating, whichever is later. If your condition worsens, contact your family doctor or call 811. Frequently asked questions. What is the point of self-isolation? This is one way every Canadian can help slow the spread of the virus in their community and protect their friends, family, and healthcare workers. Why should I self-isolate myself for 14 days if I don't have symptoms? You can be sick and not know it yet. It is important to stay at home because you can develop symptoms at any time. Can I go to work? No. You could put your co-workers at risk. Many employers have made arrangements for working from home. Can I use taxis, public transit, rideshare? No. You cannot ensure I think that's a typo, that you are 2 meters from other people. Using taxis, public transit, and ride shares puts the public at risk. Should I go to a medical appointment? If you must seek medical care, wear a mask. Try to expose as few people as possible and notify your health care provider in advance so they can make arrangements to see you safely. Walk or drive yourself to your appointment if possible. Can I go for a walk outside? Yes, it is important to continue to exercise, but it is important that you avoid crowded areas and stay at least 2 meters from other people. You should wash your hands before you leave your home and when you return. Can I go to the pharmacy to pick up my medication? No. If you need medications, use a pharmacy delivery service or ask a friend to pick them up and bring them to your home. Can I get the mail and newspaper? If your mail is delivered directly to your house, it is okay to go to your mailbox. Make sure you wash your hands. If your mail is delivered to an apartment or community mailbox, or the post office, ask a friend to pick up and deliver to you. Can I go through a drive-through for coffee or food? No. There is a risk of infecting other community members, including food service workers. Use delivery services or ask someone to deliver coffee or food to you. Should I cancel my haircut, pedicure, spa treatment? Yes. There are examples of non-essential appointments. You would be exposing your service providers and the public to unnecessary risk. Can I have visitors? No. Use technology such as video calls to keep in touch with friends and family. Can I have playdates for my kids or playdates in my home? No. Consider novel ways to keep in touch, like virtual meetings, hangouts, family dinners, or playdates for your kids. Can children play outdoors together? Can my child have a sleepover with children who are also self-isolating? No. Children need to keep 2 meters away from other people. The next section is called Self-Isolation After a COVID-19 Test. And it is 2 pages double-sided, so I shall get started on that for you. Your healthcare provider has decided It is safe for you to go home after your COVID-19 test. Next steps. 1. Return home and avoid contact with others. Self-isolate while you wait for your test results. The length of time until your results is available varies by testing location. 2. If you test positive, public health will contact you. If you are a healthcare provider, please contact your employer or follow your organization's process. 3. There are many ways that you may be able to access your test results. A. Text message. Sign up to get a negative result by text directly to your cell phone at www.bcdc.ca/health-info/diseases-conditions/COVID-19. Okay, there's a dash in the COVID-19. I think I'll just put this on screen. B. Online. Go to myehealth.ca, except for residents of Island Health and Interior Health regions. I don't know which region we are. I think we're Sea to Sky. C. Online. Residents of Interior Health region can check their results online on My Health portal at another long address I'll put on screen. D. Call. Residents of the Island Health region can call the laboratory call center line 1-866-370-8355. I'm assuming since we were given this information, it applies to us. Open on Mondays to Friday from 7 a.m. to 6 p.m. on weekends from 8 a.m. to 4 p.m. E. Call BC CDC's COVID-19 negative results line 1-833-707-2792, open from 8 a.m. to 4:30 p.m. daily. Find more testing information at, and I'll put that on screen, it's another long website address. When to seek medical care. Mild symptoms. If your symptoms are mild and can be managed at home, example, fever, cough, sneezing, or sore throat, continue self-isolating while you wait for your test results. If seeking medical care, wear a medical mask, surgical or procedural. If a medical mask is not available, use a non-medical mask or facial covering. Example, homemade cloth mask, dust mask, or bandana. Or if that is not readily available, cover your nose and mouth with a tissue when coughing or sneezing. Do not use public transportation. This includes buses, taxis, or ride sharing where you would be in contact with others. Worsening symptoms. If your symptoms worsen or you are concerned, complete the online self-assessment tool at bc.thrive.health or call 811 anytime. Examples include mild to moderate shortness of breath, inability to lie down because of difficulty breathing, any new chest pain or chronic health conditions that you are having, difficulty managing because of difficulty breathing. If your symptoms worsen, it is important to seek medical help early. Please consult your family doctor or nurse practitioner. If you are unable to reach your regular care provider, seek care at an urgent and primary care center. To find an urgent and primary care center, go to HealthLink BC Services and Resources address I'll put on screen, or emergency department. When going in person, please call ahead and tell them your symptoms and that you are self-isolating after a COVID test. Severe symptoms require immediate medical attention. Examples include severe difficulty breathing, example, struggling to breathe or speaking in single words, severe chest pain, having a very hard time waking up or feeling confused or losing consciousness. Call 911 immediately or go directly to your nearest emergency department. If possible, you or someone caring for you should call ahead and tell them your symptoms and that you are self-isolating after a COVID-19 test. How to self-isolate after a COVID-19 test. While waiting for your test results, you must self-isolate and avoid contact with other people. Do not leave your home. Do not go to work, school, or public areas, including places of worship, stores, shopping malls, and restaurants. Cancel or reschedule all appointments. Do not have visitors. It is okay for friends, family, or delivery drivers to drop off food or other necessities, but try to have them drop off deliveries outside your home or door. Go to bc.thrive.health, long internet address I'll put on screen, for more information. Avoid contact with others at your home. If possible, seniors or people with a chronic medical condition such as diabetes, lung problems, heart disease, or weakened immune systems should stay somewhere else. As this may not be possible, please see the advice below on how to limit your contact with others in your home. Stay in a separate room and use a separate bathroom if possible. Stay and sleep in a different room away from other people in your home as much as possible. Make sure that any shared rooms have good airflow, example, open windows. Use a different bathroom if available. Flush the toilet with the lid down, as the virus may be in poop, stool, or feces. Keep a physical distance. If you are in a room with other people, keep a physical distance of at least 2 meters apart, about 6 feet or the length of a queen-size bed. If you cannot avoid being in the same room as others, wear a medical mask, surgical or procedural, that covers your nose and mouth. Please read more about medical masks below under how to stop the spread of germs. Ending self-isolation. Go to bc.thrive.ca, disease conditions. Long address I'll put on screen for more information. If you test positive for COVID-19, please self-isolate until the following criteria are met. At least 10 days have passed since the start of your symptoms, and your fever is gone without the use of fever-reducing medications, example, Tylenol, Advil, and you are feeling better. Example, improvement in runny nose, sore throat, nausea, vomiting, diarrhea, fatigue. If public health provides you with different advice, follow their instructions. If you test negative for COVID-19 and your symptoms worsen, contact your healthcare provider or call 811. If you test negative for COVID-19 and you have symptoms of illness, continue to isolate until your symptoms resolve. If you test negative for COVID-19 and you are a healthcare provider, speak with your employer about return to work policies. If you test negative for COVID-19 and you are a contact of COVID-19 case, continue to self-isolate for 14 days from your last contact. If you test negative for COVID-19 and you are a traveler returning to Canada, you must continue to isolate for 14 days from arrival back in BC. How to stop the spread of germs. Wear a face mask if in the same room as others. Go to www.bc.cdc.ca, long address, disease conditions, prevention risks, masks. I'll put it on screen for more information. When you are sick, a medical face mask, surgical or procedural, acts as a barrier and helps stop tiny droplets from spreading when you cough or sneeze. Wearing a face mask can help to prevent the spread of germs at home. If your medical face mask gets wet or dirty, change it. Do not reuse masks. Throw used medical face masks in a lined trash can and wash your hands with soap and water. If a medical mask is not available, use a non-medical mask or facial covering. Example, homemade cloth mask, dust mask, bandana, or if that is not readily available, cover your nose and mouth with a tissue when coughing or sneezing. Wash your hands. Avoid touching your eyes, nose, and mouth with unwashed hands. Wash your hands often with soap and water for at least 20 seconds. Hand washing is preferred over alcohol-based sanitizers. Only use alcohol-based hand sanitizer if soap and water are not available. It is best to dry your hands with a paper towel and throw it away into a lined trash can. If using your own cloth hand towels, no one else in the home should use it. Cover your coughs and sneezes. Cover your mouth and nose with a tissue when you cough or sneeze into your upper sleeve or elbow, not your hand. Throw used tissues into a lined trash can and wash your hands with soap and water. Shared items. Do not share dishes, drinking glasses, cups, eating utensils, towels, bedding, or any other item with the person who is sick. After use, these items should be washed with soap or detergent in warm water. No special soap is needed, and you can use the dishwasher. Clean and disinfect household surfaces. Learn more about cleaning and disinfecting your home to limit the spread of COVID-19 at BC CDC, disease conditions, prevention risks, cleaning and disinfecting. Long address I'll put on screen. Use precautions when cleaning surfaces in contact with respiratory secretions or bodily fluids. Some cough, sneeze, and throw up or has diarrhea. Use disposable gloves and a medical mask, or if not available, a non-medical mask or facial covering. Example, homemade cloth mask, dust mask, or bandana. And protective clothing. Example, plastic apron, if you have one, when cleaning surfaces soiled with bodily fluids. Step 1. Clean away dirt, crumbs, etc. Use soapy water to wipe away dirt, soils, and other debris. Plain dish soap or any kind of household cleaning product will remove dirt, soils, and other debris from surfaces. Step 2. Disinfect. Frequently touched surfaces such as toilets, sink tap handles, doorknobs, light switches, and tables should be cleaned and disinfected at least daily. Less frequently touched surfaces should be cleaned regularly when visibly dirty. If possible, use store-bought disinfectants. Familiar brands such as Clorox, Lysol, Fantastic, Microban, and Zep have ingredients that will work against the COVID-19 virus. If store-bought disinfectants are not available, you can mix household bleach with room temperature water. Do not use hot water To disinfect areas in your home, 20 milliliters of bleach to 1 liter of water. Laundry. Use precautions when doing laundry for the person who is sick. Laundry can have respiratory secretions or body fluids on it. This can happen when someone coughs, sneezes, throws up, or has diarrhea. This laundry should be placed into a laundry bag or basket with a plastic liner and should not be shaken. When doing laundry, wear gloves and a medical mask, or if not available, a non-medical mask or facial covering. Clothing and linens belonging to the sick person who is sick can be washed together with other laundry using regular laundry soap and hot water. Laundry should be thoroughly dried. Wash your hands after touching the laundry and after removing gloves. If the laundry container comes in contact with the laundry of the person who is sick, it can be disinfected using store-bought disinfectant or a mix of household bleach, 20 milliliters bleach to 1 liter of water. Be careful when handling garbage. All used paper towels, masks, and tissues should be put into a trash can lined with a plastic bag to make garbage disposal easier and safer. Wash your hands with soap and water immediately after handling garbage. This last page has pictures. I'll read you the headings and show you the pictures all at once, and then I'll read it all through over the knitting. Get all my video editing all done in one go. So here we go. Wash your hands often. Wear mask and gloves. Dispose of gloves and mask after use. Do not have visitors in your home. Avoid sharing household items. Clean. Wash laundry thoroughly. Be careful when touching waste. So those are the headings and the pictures that go with the headings. I hope you're hanging in there. We're getting to the end here. Last page. Guide for caregivers and household members of those with COVID-19, people who are in close contact. If you are caring for or living with someone who has COVID-19 or respiratory symptoms, you are considered a close contact. You will be given special instructions about how to monitor your own health, what to do if you start to feel sick, and who to contact. Be sure to tell healthcare providers that you are a close contact of someone with COVID-19. If the symptoms of the person you are caring for begin to worsen, contact a healthcare provider for medical attention. If it is an emergency, such as severe chest pains or struggling to breathe, call 911 or go to the nearest emergency department and notify them the person you are caring for has COVID-19 or symptoms. Wash your hands. Wash your hands with soap and water after each contact with the infected person. Use an alcohol-based hand sanitizer if soap and water are not available. Wear mask and gloves. Wear a mask, surgical procedure mask, and gloves when you have contact with the person's saliva or other bodily fluids. Example, blood, sweat, saliva, vomit, urine, and feces, and when providing direct contact care. Dispose of gloves and mask after use. Take off the gloves first without touching the outside of the gloves and wash your hands with soap and water before taking off your mask. After taking off your mask, wash your hands again with soap and water before touching your face or doing anything else. Take the gloves and mask off right after you provide care and dispose of them in the waste basket lined with the plastic bag. Do not have visitors to your home. It is okay for friends, family, or delivery drivers to drop off food or other necessities, but have them drop off deliveries outside your home. Keep older adults and people with chronic medical conditions, for example, diabetes, lung problems, heart disease, or weakened immune system, away from the infected person. Avoid sharing household items. Do not share dishes, drinking glasses, cups, eating utensils, towels, bedding, or any other item with the person who is sick. After use, these items should be washed with soap and detergent in warm water. No special soap is needed. Dishwashers and washing machines can be used. Do not share cigarettes or other items that are put in the mouth. Clean. Clean your home with regular household cleaners. Clean regularly touched items such as toilets, sink tap handles, doorknobs, and bedside tables once or twice daily. Use store-bought disinfectants. If not available, use diluted bleach solution, 1 part bleach and 50 parts water to allow the surface to remain wet for 1 minute. Wash laundry thoroughly. Contaminated laundry should be placed in a laundry basket with a plastic liner. Wear gloves and mask when handling. Wash with regular laundry soap and hot water, 60 to 90 degrees Celsius. Clean your hands with soap and water immediately after removing your gloves. Be careful when touching waste. All waste can go into regular garbage bins. When emptying waste baskets, take care not to touch used tissue with your hands. Lining the waste basket with a plastic bag makes waste disposal easier and safer. Clean your hands with soap and water after emptying the waste basket. Contact your local public health unit. Visit Immunize bc.thrive.health to locate your nearest public health unit. And that's that for that. That's the last page. I hope I've been helpful, and I hope you managed to stick it out this long, or maybe even read the pages yourself if you have your hands on them. And if you know anybody who doesn't have the pages or may not want to read them, share my video. I love you all, and I want you to be safe and wear your mask and stay home and do all the things that our Chief Dean has been saying for the last couple of days. It's important that these numbers stop growing. All of our people are precious. Thanks for watching.